Yeah, we introduced earlier this year StatDocs, who has since been purchased by Teledoc, for our employees and offer it to our employee groups. We had a couple of fun things, and John Stevens from our shop is in the audience, and he's the one who kind of engineered this whole thing. At both a management meeting with 300 people in the room and a board meeting with, I don't know, 15 people in the room, we did a virtual visit with a doctor. And it really works slick. But it's really about convenience and meeting your customer where your customer needs help. When you think about how busy everybody is it for everything, right? If you have a really bad diagnosis or something, you're not going to want to do that. But there are sometimes you just want to know, you just want to check. You're heading out on a vacation or a trip, business or personal, whatever, and you want to know, is this okay to go on that? Or you need a refill on a prescription on certain items, and it's a convenient way to do it. It's just one more delivery mechanism that's going to work in some situations.
Terry, where are you guys at?
So we're all in on telehealth. We Unity helped UW fund its e-visits behind its portal. We sit behind the portal also. So about 2 years ago, we actually helped create the technology to do that. Today, they're in the process of introducing telederm, and one of our biggest challenges is getting people in to see dermatologists. But it's a very visual type of medicine. So you can take a picture with a smartphone, and then people will be able to take a picture with a smartphone, upload it into MyChart, and have a dermatologist read it. The beauty of that being that you can move the melanomas to the front of the line. You have a lot of referrals from primary care docs who really don't understand skin. And by taking a picture and sending it in, you can really change the practice of medicine in a very positive manner.
We're all in with telehealth as well. We're also doing telederm, but a couple of years ago, or just over a year ago, we introduced Virtuel, which is actually designed by health partners in the Twin Cities. We offer that to all of our members, and it's essentially an online clinic. I think that it's only logical that we would find a way to use this technology to interact and connect with the patients.
Molina nationwide is using telemedicine. We haven't adopted that quite yet here in Wisconsin. Being largely a Medicaid organization, we're very interested in seeing the current bill and seeing how that goes through because that'll have a direct effect for us. I think one thing also just to share is the value of telemedicine in behavioral health, particularly in rural Wisconsin.
I think telehealth is a very positive development. I'm glad to hear that we're all moving in that direction at various paces. We are as well. I think it's a big convenience factor. I think it's certainly suitable for many primary care conditions. It's better for the patient. It's going to cost less overall. I think that's positive. I think it's going to help improve quality, improve outcomes, and have a prevent lower costs.
Thank you guys so much for coming. Thanks to our great panelists for a great discussion today.